Hi, I'm Ben Taus, a workers' liberty activist, Unison member and co-founder of the Labour Campaign for Free Movement. I want to talk today about the government's anti-migrant policies in the coronavirus crisis. You might have seen the news, the government's extending the visas of foreign nationals who are unable to return home due to the pandemic, and that it's released 300 people from immigration detention centres. Both of these are the result of pressure from campaigners, and we need much more. The regime of hostile policies that's imposed on both documented and undocumented migrants in this country is already a racist scandal. But now, that regime poses an even more acute threat to migrant safety, and it risks exacerbating the public health crisis. So here are 6 measures we need. Number 1, free all detainees now. Pressure and legal action has forced the government to release some people from immigration detention centres, but hundreds remain imprisoned in what are basically potential virus incubators. We know that close quarters incarceration means that the virus could spread fast. Not only that, now support groups are receiving horror stories from detainees telling them that there's no soap, no sanitizer, sometimes not even running water, lack of access to proper healthcare and medications. The government's got to open the cells immediately and let the detainees go back to their homes. The people released need to be supported with decent healthcare as they need it, and decent housing and financial support if they don't have it, so that those who need to self-isolate can do so. Number 2, protecting asylum seekers in shared accommodation. Asylum seekers are sheltered in temporary accommodation that has long been contracted out to the private sector. It's often overcrowded and poor quality, so we need independent health inspections, and we need to relocate particularly vulnerable people and anyone in accommodation found to be below standards, and we need specific healthcare provisions. Now, for both the asylum seekers who need to be relocated and released detainees who don't have decent housing to return to, as well as all homeless people, whether they're UK citizens or not, the government has got to be prepared to requisition housing if necessary. Now, this might mean homes left empty by landlords and property speculators, or it might mean hotels and the like. And what we've seen in the past couple of days from Britannia hotels turfing out the homeless people that they just recently agreed to house during the crisis shows them why we can't just rely on the goodwill of business owners. We need to requisition those resources and take them under public control and management by the workers and the people using those services. Because decent quality, warm, non-overcrowded housing is a human right at any time, and even more so in the middle of a pandemic. Number 3, stop all NHS charging and data sharing with the Home Office. So we know from extensive evidence that NHS charging and the threat of information being shared with the Home Office deters migrants from accessing healthcare. Even where specific diseases are exempt, like COVID-19 is, there are still charges for any other conditions that they might have at the same time, plus the threat that they might be targeted by immigration enforcement. So all NHS charging needs to be halted now. A firewall has got to be established to prevent any data sharing with immigration authorities, and the government's got to mount a publicity campaign to let everyone know that they can access the NHS without fear. Ireland and New York City have already taken measures like this, so should the UK. And that same sort of firewalling needs to be in place for all the services that people will need to access during the crisis. Number 4, suspend no recourse to public funds. With self-isolation and now lockdown affecting people's incomes, the need for financial support for workers has become more acute. We can't obey medical advice if staying home means not having enough money to feed ourselves or to keep the heating on. And that includes everyone. So, the pernicious no recourse to public funds conditions that deny the majority of migrants access to social security have got to be suspended right now. This was finally raised by Shadow Home Secretary Diane Abbott after campaigning by migrants' rights groups, the Labour Campaign for Free Movement and others for a very long time, and we've got to press the government to follow. Number 5, no penalties for staying home. Similarly, the Home Office has got to suspend the conditions that force many visa holders to report in regularly, and it's got to issue reassurances that anyone who's forced to miss an appointment or a deadline will face no penalty. Number 6, and last, visa extensions. The Home Office has finally, after a long time, announced that it will extend the visas of anyone who's self-isolating or who can't leave because the country that they're due to return to has a travel ban. This is a no-brainer and it's long overdue, but it's not enough. For one thing, this is the same Home Office that told gay asylum seekers to go back to Afghanistan, where homosexuality is illegal, and just pretend to be straight. We can't trust them to decide when or where it's safe for someone to travel. I mean, in the current situation, it's an unacceptable risk just to ask someone to pack up their life and travel to an airport and take a flight, wherever they're going. It's absurd that any immigration enforcement is happening at all. Enforcing visa expirations or trawling neighbourhoods for undocumented migrants is clearly not essential work. All permissions to stay need to be extended till the crisis is over. Immigration enforcement should be suspended, and it's Home Office staff who should be sent home. Or they should be given something useful to do combating the public health crisis. But on the contrary, Parliament's just granted immigration officials emergency policing powers. It's a complete move in the wrong direction, and it's a clear threat to liberty, especially if the powers are kept after the crisis, as we know emergency powers often are. Now, these 6 demands are temporary measures that are acutely needed to face the crisis. We can all raise them by contacting MPs and on social media, and most importantly, key workers delivering crucial services have a particular role to play, raising them through our unions and potentially even through workplace action. But beyond the pandemic, most of these measures would ideally be permanent. Public health crises force us to remember that our individual well-being is connected to that of others around us. As long as any of us are subject to repression and precarity, none of us can be truly free and secure. So, when the crisis subsides, let's not forget it. Let's fight for a permanent end to the violent injustices of detention, deportation and destitution, and for an NHS social security system and a housing system with decent provision that are truly universal. So, let us know what you think, thanks for listening, and let us know what action you're taking. Solidarity.